Hello. Everybody hear me? This is kind of weird. I can't hear myself. But okay, yeah. So we're going to talk about heart disease today, and I think that when we think about heart disease, people think about lipids, right? Think about biochemistry, assessing the biochemistry in the blood. And I want to talk about the biophysics of heart disease because when I looked into it, it became much more about this than it was about biochemistry. So I will start off by telling why I got so interested in this. So I've been very health conscious my entire adult life. Ever since I figured out I could change the way I live my life in college and have a direct impact on my health, and no doctor ever told me that, I found that interesting. But I always ate a whole foods diet, exercised regularly, avoided toxin exposure, and managed my blood sugars as a type 1 diabetic effectively. I've been type 1 since I was 9 years old. And then in June 2020, a nurse practitioner suggested I get a CAC score, which is a measurement of how much calcified plaque there is in the arteries of your heart. And I came back with a perfect score of 0. So I felt like, hey, I'm doing pretty good. And then that puts me at very low risk for a heart attack. So you can see there's multiple studies that show that if a CAC score is 0, you're like a 1% risk of a heart attack. But then 6 months later, I had a heart attack. A massive heart attack, widowmaker. So you can see the blockage there, right there. So 100% blockage of the left anterior descending artery. And I always get asked this question, so I always address it. No, I never had the COVID injection. People always say, hey, that's what happened, right? It was that time. It was 2021. But no, never did. Never even had COVID, I don't think. Or if I did, I didn't have any symptoms. And the other thing was that there was no hard plaque. The CAC score showed there was no hard plaque, but there was also very little soft plaque. There was just this blockage. There was a mild amount of soft plaque in the RCA, but it was not enough to cause any issues. It was just this major clot there. So this is where it left me in the hospital, feeling a bit demoralized, dejected. I tried to take care of myself, and here I have this heart attack. So my ejection fraction in my heart had dropped to 35 to 40%, which normal is 50 to 70%, because there was damage to the tissue of my heart. And the conductivity of the tissue that had been damaged had dropped to akinetic. So it wasn't conducting the signal of heart contraction through that tissue. And then a few months later, I started becoming active again, and I noticed that I was getting pain in my right lower leg below the knee. And what had happened was because when they did the heart cath procedure, they went in through the artery in my groin, they came up and they placed a stent in my heart. But the device they used to seal the artery after they were done interfered with the blood flow dynamics down my leg, and I developed plaque in my leg, and then blood wasn't getting to my leg. And so if I would exert myself, I would feel it would be painful. I couldn't even walk fast without pain in my leg. And so it was a 70 to 99% blockage of plaque in my leg. They decided not to do anything about it because they said, well, if we mess with these things, they get worse. You can do most of the things you can in your life. You just can't do some of the things you like. We're just gonna leave it alone. And I said, okay. So that was my situation. And when I asked people in the hospital, like, why'd I have a heart attack? What happened? At that point, I was just throwing my hands up like, what do you got for me? And this is what I got. Your cholesterol is high. It didn't matter if it was an intern, a resident, or a student, because it was a teaching hospital. They all said, your cholesterol is high. And mine was high. And I knew that it was high because of the way I eat. Lower carb diets, which is easy for managing type 1 diabetes, can create elevated lipids. But it's always in the context of lower inflammation, good metabolic health. And there's tons of research about that, how that's not increasing your risk. However, these are all associational studies that show that the higher your cholesterol is as you age, the higher cognitive abilities you have, the less cancer you have, the less heart disease you have, the lower rates of infection you have, and the lowest all-cause mortality from anything you have. So it doesn't, you can find associational studies that say that, yes, higher LDL levels are associated with increased risk of heart disease. But these studies are very unreliable because they're just showing associations. But this one here is a review study. And what they say is that the idea that high cholesterol levels in the blood are the main cause of cardiovascular disease is impossible because people with low levels become just as atherosclerotic as people with high levels. And the risk from suffering cardiovascular disease is the same or higher. So there's a robust amount of research that says that. So this is what we use to assess, what medicine uses to assess for risk of heart disease, the main tool. There's many things they use, but they're looking at the lipids, right? They're looking at the biochemistry. And it's not just your standard LDL panel. Now they're looking at the ApoB levels and looking at oxidized LDL and all this stuff, but it's all biochemistry. And I had rejected this model. Based on previous knowledge, I rejected this model, and I was okay with my LDL being that high. But to reject one paradigm without simultaneously substituting another is to reject science itself. So maybe that was my mistake. Maybe I didn't replace it with another paradigm. And I'm going to tell you what I've replaced it with today. So this is the traditional way we see plaque illustrated. If you just go online and you type it in, it's happening on like the inside lining of the artery. That's the pictures. That's what we think it happens. So it's like cholesterol is just depositing itself on the inside of the lining of the artery. But when we actually look at imaging, this is a AI scan, clearly scan of an artery, you can see that the plaque is forming in the artery wall. It's not on the lining of the artery in here, it's inside the artery wall, so the artery wall is like expanding like this, right? So these types of pictures, they're all over the place, are inaccurate, they're false, okay? So what's actually happening is, so we have the lining of the artery here, right? And this is endothelial cells, this is just a layer of cells, right? And where plaque happens is in this layer here, the intimal layer of plaque. That's where it originally starts. Now, these cells that line the artery, they have to have a blood supply too. And that blood supply does not come from the blood in the middle of the artery, okay? It comes from the blood vessels that supply the artery wall. They're called the vasa vasorum. They come around and they supply the artery wall. Now, what happens is, these cells can start to grow or proliferate or multiply. And we're going to talk about why they can start to do that in a minute. But when they start to grow like that, they start to grow inward, and that narrows the artery a little bit. They also need, those new cells also need a blood supply. So these arteries start to grow in. They start to grow in to supply these new cells with a blood supply, right? And eventually, so what happens when new blood vessels start to grow is they're leaky, right? It's kind of like when you're growing something new, like you're building a new house, there's a point where there's no windows or doors on it yet, so it's leaking. And blood leaks out right into the intimal layer, and blood that is not in a tube, that is an artery, is stagnant blood, and stagnant blood likes to clot. And so that's where we see the clotting tissue start, is right here in the intimal layer, not on the lining of the artery. And then we can see some cholesterol present in that because there's cholesterol in blood. And if blood leaks out, cholesterol is going to be present. But it's not the cause of anything. The cause is the proliferation of these cells here. So what happens in atherosclerosis, which is plaque, heart attacks, and strokes? Most people would agree that it's a clotting issue, right? A clot happens and that causes a problem. And in the case of atherosclerosis, that's the case too. People have said that it's this accumulation of cholesterol. But it's not, because when you look at this study here, it's a large percentage fibrotic clotting tissue. So 87% plus or minus 8% is clotting tissue. There's also some calcific deposits and some pultaceous debris, which is fun to say, but it just means like byproducts of like inflammatory responses, and foam cells, which is also an inflammatory response thing. But the majority of it is clotting tissue. And I've had people tell me that it's, the cholesterol starts the problem, and then the clotting tissue comes along later, which doesn't make sense. But there's research to show that the clotting tissue plays a role from the beginning, right? This study here says it right in the title: platelets modulate atherogenesis. Platelets are involved in clotting. It's not cholesterol modulates atherogenesis; it's platelets. This study here takes the focus. It argues we should take the focus away from looking at the plaque formation and move toward minimizing clotting risk. And then this here is an article written by Dr. Malcolm Kendrick, who wrote a book called The Clot Thickens, and he talked all about the evidence that atherosclerosis is a clotting problem. And I showed you where that clotting can take place. It takes place in the artery wall, not on the lining of the artery. So we have a clotting issue, but what could start this whole thing in process, right? It's the proliferation, the growing of those endothelial cells. And there are two main things, there's lots of things, but there's two main things that can make the endothelial lining grow. One is damage, right? Physical damage. And so there's lots of things that can cause physical damage. But when you cause damage, you have a healing response, and that's a proliferative response. It's where you're making new tissue. So the cells start to grow a little bit. So anything that can cause damage. And there are many things that can cause damage. These are just some of them. So, and I'm not going to go into each one of these specifically, but having a glucose-based metabolism where your blood sugars are up and down all day long, fluctuating blood sugars, advanced glycation end products, which are when things get damaged by glucose, or we damage sugar in the body. Oxidized fats, so like if you're eating oxidized fats, which mainly come in the form of polyunsaturated fats like seed oils and things, but also if the fats in your body get damaged because you're in an inflamed state. Endotoxemia, which is the presence of gram-negative bacteria in your bloodstream, which shouldn't be there, so you can get this from like leaky gut or from poor dental health and dental infections. Psychological stress can just be just that itself, like an acute stress can cause an inflammatory response to the lining of the artery. Heavy metals like cadmium and mercury and those types of things, which there's many places that we're exposed to that. Smoking and air pollution, BPA, the plasticizer, but BPA free is great, but they have to have some sort of plasticizer, so BPZ, and if it's plastic, it's got one of those in them. And then the three on the end there, those are just things so those are all things that can, the first things I talked about are things that can cause the damage. The things on the end are things that interfere with the body's ability to heal the damage. And if you can't heal the damage, the proliferation continues, and we get that response from the vasovasorum. So the one thing is physical damage. The other thing that I came across, which was fascinating to me, was there's two different scientists that have a robust amount of work that show that changes in blood flow can also cause this proliferation. So this guy, Mayor Texan, he's got a cool name, he was able to induce atherosclerosis in dogs just by changing the blood flow dynamics in the bloodstream. And so what happens is there's this Goldilocks amount of blood flow that we need, and it's supposed to be moving at that level. And if it goes too fast or too slow, the body doesn't like that. And so if it's too slow, it'll try and narrow the artery to increase the pressure so that it goes faster. Kind of like when you put your thumb over the end of a garden hose and it creates less surface area, so it'll go faster out of the hose. Or if it goes too fast, right? If it goes too fast, there's also not enough lateral pressure. That's what the body wants, is lateral pressure pushing out on the artery wall a little bit. And so if it goes too fast or too slow, it doesn't do that. So it going too fast explains why we see marathon runners with higher levels of atherosclerosis, because their blood is moving fast for a lot longer than people's who don't marathon run. And so they get this proliferation. So if we don't have that lateral pressure, the body starts to grow endothelial cells in trying to create the lateral pressure. And so that's what he was able to do, is induce atherosclerosis in dogs in that way. And then this other guy, Richard Thoma, most of his work is in German, but luckily this is funny. Luckily this Russian guy translated it, and so he summarizes it in many articles. He basically found that if you interrupt blood flow, you create atherosclerosis. If you change blood flow dynamics, pretty much. So those are the two things, right? So what could we do to protect the lining of the artery and keep blood moving? That's the name of the game. Regardless of what the lipids say, these are what we need to do. Analyzing these things tells us nothing about that, okay? And it's probably why 60, 70 years of analyzing these things has gotten us nowhere with heart disease, because it's not telling us the answer. It's not telling us what to do. And then all they do is they give medications to correct these things, or they freak us out or whatever, and it's not working. It's clearly not working. Heart disease is still the #1 killer in the world. So we cannot solve our problems with the same level of thinking that created them. So at some point somebody said, it was Ansel Keys, he said that heart disease is caused by cholesterol and LDL in the blood. And that's the level of thinking that he was at. So we need a new level of thinking to try and understand how we should prevent heart disease. And that is structured water. So I know that the last guy yesterday was talking about structured water. And I'm going to explain to you exactly what it is and how it works in the body. So this is something that scientists have come across the last 100 years or so. They found that water can exist in this state that's not ice, not liquid, or not steam. There's this fourth phase of water. So it has many different names: structured water, fourth phase water, exclusion zone water, bound water. But we're a large percentage water, so it's relevant to us. The scientist that's made it most notable is Dr. Gerald Pollack. He's got a lab at University of Washington. He wrote a book about it. He goes on lots of podcasts. But many scientists, Gilbert Link's probably my favorite one. His books are hard to get through. They're pretty dense, but he's a fascinating guy. Albert St. Georgi won the Nobel Prize. He talks about structured water. Fritz Albert Popp, very notable scientists that write about this and have figured this out. So what is structured water? So water has an oxygen and a hydrogen, and then this other hydrogen. This one gets cleaved off. So water can hold energy. Our life is all about gaining energy from the environment. If we can gain energy in a certain way, we're going to build structured water, because structured water is a storage form of energy in the body. So when water holds energy and it gets next to a hydrophilic surface, a surface that is water-loving, it will become structured water. So what that means is that one of the hydrogens, oops, wrong button, one of the hydrogens is cleaved off, and this oxygen and hydrogen teams up with other oxygens and hydrogens, and they form this lattice-like structure. And these planar lattice-like structures kind of stack on top of each other on the hydrophilic surface. And so that becomes this layer here. And this is more like a gel, so it's kind of between ice and water. And most of the water in our bodies is in the gel state, which is why I feel like a gel, and you feel like a gel, because the water's in this state. So in Dr. Pollack's lab, what they found, they looked for places of exclusion zone water where this water would form. And they found that on natural biological surfaces, including vascular endothelia, which is what we're talking about here. So here's an image from one of Dr. Pollack's studies where you can see the lining of the artery here, and then the cells are in the middle, and then there's this layer here of EZ. And if you go into the research and you type in cell-free layer, there's tons of other scientists besides Dr. Pollack that have found there's this layer here where the cells, the cells in the red blood cells in the blood can't touch the lining of the artery because there's this cell-free layer there. And Dr. Pollack found that this was structured water. So this is a decent depiction of it. These authors didn't understand one property of structured water, which you're going to learn about, so these shouldn't be in here. But people talk about the glycocalyx, this brush border kind of shag carpet thing on the lining of the artery, and they call it a gel-like substance. But it's not a gel-like substance. The gel-like substance is structured water forming on the glycocalyx, because the glycocalyx is a hydrophilic surface, and it's providing surface area for more structured water to form on it. So the structured water is what provides this gel-like, this anticoagulant gel-like layer. So the reason it's called exclusion zone water is because these kind of fence panel-like, planar-like things don't stack up on each other exactly like this. They stack more like this because of the weak bonds from these positive and negative molecules. And so when that happens, there's a very small space in here. And so that small space makes it so that very little or anything, almost nothing, can penetrate this. So it's called exclusion zone because it excludes things that aren't it. And so in Dr. Pollack's book, he notes that the protein albumin was excluded. And that's relevant because the protein albumin is the smallest protein in the blood. So if that's excluded, anything bigger than albumin can't touch the lining of the artery if we have structured water. So albumin is 3.8 nanometers in diameter. A red blood cell is way bigger than that. LDL is way bigger than that. Even HDL is bigger than that. And HDL is the smallest lipoprotein that you measure on your lipid panel. And even when LDLs become damaged and oxidized and get smaller, they're still not smaller than HDL. So if we have structured water there, those LDLs are never going to touch the lining of the artery. And that's this whole theory of heart disease, is that these LDLs are somehow just like deciding one day I'm going to go and embed myself in the lining of the artery. And that's impossible if we have structured water. So sodium ion can't penetrate structured water either, but potassium ion can. So the difference between what can penetrate and what can is 0.02 nanometers, which is crazy to me. And it's based off this Hofmeister series of hydrated ions. So this is the cutoff, sodium, potassium. Anything smaller can penetrate structured water, bigger can't. So you can see this image here, the inaccuracy is that nothing would be in the structured water. But this, I put this up here because it's a good picture. Here's the endothelial cells, glycocalyx, structured water on top of it, red blood cells on top of that. That's the situation. And you can kind of see here, there'd be this layer of structured water in there, okay? So in that sense, structured water is protective of the lining of the artery, which is one of the things we need to do in order to prevent this growth of the endothelial cells that cause the response that causes atherosclerosis. So we need to build structured water. Now, the other thing that's interesting is that when structured water forms, it's very electronegatively charged, and because of the hydrogens that get cleaved off, this is very positively charged area here, so a positive and a negative next to each other is a battery. And so they've actually done these experiments where they put the electrode into the electrode of a light bulb into the negative end and the positive end, and they can power the light bulb. So we are structured water batteries powered by the sun. And so in this case, what happens, what they did is they put this hydrophilic tube in a vat of water, and then they put infrared light on the vat of water, and the water started flowing through the tube with no pump acting on it whatsoever. So the energy created by this battery does the work of moving fluid in a tube. And that's exactly what they found. So this, maybe, is a video that a student in Dr. Pollack's lab was nice enough to send me. They've euthanized the chick embryo. Sorry for the animal lovers. But they euthanized the chick embryo. This is 13 minutes after the chick embryo's heart has stopped beating. And uh-oh, it's not going to play. No? No worries. So basically, the blood's still moving. You can see the blood's still moving. And then when they put infrared light on the chick embryo specimen, the blood flow increased 300%. So pretty impressive. So one reason that, so addressing the fact that higher levels of plaque are associated with higher levels of heart attacks, right? Why is that? It's because if there's plaque in the artery here, like this is depicting on the artery wall. Remember, it's expanding both sides of the artery wall like that. But if there's plaque in there like that, now we're creating turbulent blood flow. And turbulent blood flow is more likely to be stagnant, and stagnant blood will clot. And so that can cause a clot that can cause a heart attack or furthering atherosclerosis. So at first, it starts in the artery wall here, expanding, but then it can cause clotting here, and if it clots just right there, it can cause further atherosclerosis. But it all starts in the artery wall first. So we have plenty of research that shows that more stagnant blood clots, and it's why people with arrhythmias who have this interfered blood flow because the heart rhythm is not like what it should be are put on blood thinners because there's this increased risk of clotting because we're interrupting blood flow. And this is what atherosclerosis is, or one thing that causes atherosclerosis. So what's like the kind of this take home is that the three big reasons why I think we have this problem with atherosclerosis, it's the number one disease in the world, is one, we've removed things that build structured water in our bodies. And we're going to talk about what those are in a minute. But they're mainly grounding, being in contact with the earth, and infrared light, which comes from the sun. We're living more indoors than ever, and we've also switched out infrared or incandescent light bulbs with LEDs and fluorescence. So we're devoiding ourselves of infrared light, which charges the body and builds structured water. We've added exposure to things that break down exclusion zone water. So now in the face of not having that exclusion zone water there, we've added things that now damage it, which are lots of toxin exposures. So anything that's said to be inflammatory or cause oxidative stress is really just stealing charge from structured water. And so it's breaking it down. But also electromagnetic fields, wireless signals have also been shown to break down structured water in the body. And we're surrounded by those these days. And then we've interfered with the body's ability to heal the lining of the artery. We've done that in two ways. One, we've created an epidemic of type 2 diabetes, and the number one thing you need to build new arteries and make them, like when you're trying to respond, that the vasa vasorum are trying to respond, is you need insulin signaling to do that. It's the signal for growth and repair. And if you're insulin resistant, like in type 2 diabetes, you don't do that very well, the arteries stay leaky for longer. That's why diabetes is the number one risk factor for heart disease. So how do we fix it? We get more sunlight and grounding. We avoid toxins and non-native electromagnetic fields. And we optimize our circadian rhythm, which is what creates a healing response. And we eat a whole foods diet that creates metabolic flexibility. That's how you create insulin sensitivity. People think it's only about diet, but it's not. I think the underlying issue is circadian disruption because our light environments are off because we have artificial light telling us that it's the wrong time of day. And so if you don't do that, you don't get the deep healing restorative sleep that you should. And and we don't have enough melatonin. Melatonin has been shown to be amazing for the lining of the artery. So, yeah. So, back to me. What did I do? My diet stayed about the same. So I was eating a low-carb, animal-based diet, and my exercise stayed about the same once I figured out that I could use a bike rather than run and play soccer and stuff. And it wouldn't hurt my leg if I used a bike. I guess it's more quads. And so my exercise stayed about the same. I took a blood thinner for 6 months. It's the only thing I did that medicine recommended was took a blood thinner because there was a stent in my heart that was going to interrupt blood flow for a while. So I took the blood thinner. But they wanted me on 5 medications the rest of my life. They told me to eat a processed food diet in the hospital. I couldn't believe the list they gave me in the hospital of the foods. Like animal crackers. I don't know if they have that here, but animal crackers were okay to eat. It's just processed food. And my LDL stayed the same. So that's in milligram per deciliter, and then over there it's in millimoles for you guys. So my LDL is consistently high because of the way that I eat and that low-carb diet. And just to explain that to you, so like when you go on a low-carb diet, you're giving your body one fuel source to burn, and that fuel source is fatty acids. And so if you have one fuel source, your body has to deliver more of those fatty acids to your tissues. So that means that LDL is what takes those fatty acids and delivers them to tissue. So you have higher LDL delivering more to the tissues. And if I ate more carbohydrate, then my body would have glucose to burn. So it wouldn't need as many LDLs around, and so the LDL will come down. And they've shown that eloquently in studies that it's all about metabolism. It has no reflection of heart disease. it's all about what you're metabolizing. So on a low-carb diet, mine stays elevated. I mean, sometimes really elevated up in there. So what I did do is a lot of this. I got a lot more sunlight. I started grounding a lot more. And those are things that I knew about, but I wasn't prioritizing. And I bought a sauna, infrared sauna, to just boost my infrared light, and I use that pretty much every day. And I also set my circadian rhythm. For the first time in my life, I really got diligent about that. I bought the glasses, kept the lights dimmer in the evening, and set my circadian rhythm. And in 3 months, I went back and did the echocardiogram, and my heart had healed. It had returned pretty much to normal. Ejection fraction was normal. The heart conduction signal was contracting normal or being sent through the heart tissue normally. And that would have happened a little bit on its own just because of healing. But the doctor was like, I see you decided to take your medications. And I was like, well, I didn't actually take my medications. But they didn't know what else to say, you know. And then this is the artery in my leg. You can see the stenosis that happened, and the blood was having to squeeze through that spot there. And so a year later, I went back and got the ultrasound again, and it was only 0 to 50% blocked. And at the time, they sent the technician back in to do the test again because they didn't believe the result. And they'd send her back in, and it was normal again, or it was declined again. And at that time, the vascular surgeon said, well, we can't say it's better because we don't see these things get better, which didn't make sense to me. But anyways, so then a year later, I came back, and the artery was completely normal. And I tell this story, like, I remember the vascular surgeon was in there, he was saying something, but I wasn't even listening to what he was saying because he was trying to like back out of it or give reasons why this wasn't true or whatever, and the technician was standing behind him like, it's normal. Because she'd been doing it for 35 years. Her name was Doris, she was nice. Anyways, and then I came back a year after that and it was still normal. So I've sustained this, and I can run now, I can play soccer. So I reversed a 70 to 99% blockage of plaque, which they told me was impossible, especially for a type 1 diabetic. Like if you look at the literature, type 1s fare worse with peripheral artery disease than even type 2 diabetics for some reason, and I was able to reverse it. And they just said, okay, well, I guess you don't have to come back. All right, thanks. And then I recently got Clearly test done, so I did a CT angiogram and I sent it to Clearly. It's a company that uses AI to kind of map your arteries. And so this is what an artery full of plaque is. You've seen this in the presentation already, all the plaque, and this is what normal arteries will look like, okay? So this is kind of the report from mine. My coronary arteries are pretty much clean. I still have that small amount of plaque in the RCA that was there at the time of the heart attack, so it hasn't progressed. And this is with LDL levels astronomically high, according to the authorities, right? For the last probably 7 years, they've been high. And I had a heart attack, my heart healed, and I reversed plaque all during this time, and the LDL stayed the same. And here's just the imaging. So this is the stent in my heart, and the Clearly the Clearly technology can't determine if that's plaque or metal. They just look at the density of it, and so they can't comment on that. But there's the stent. There's the small amount of plaque in the RCA there, but the rest of my arteries are clean. Even downstream from the stent is clean, which the stent can interrupt blood flow, but it's clean. And there's the circumflex and the artery there, and the two branches from that. So, continuing to look at these things is never going to give us the answer to heart disease, and that's what the doctors keep harping on. They just keep on testing your lipids and giving you medications for these types of things. But I reject this model, and we need to change the model. But you're never going to change things by resisting the existing reality. To change something, build a new model that makes the existing model obsolete. And I like to think that's what I try and do, or how I conceptualize things. So that's it. Hope you thought it was good.